Morning. It's beautiful here in Eastern Ontario. We'd like to welcome everybody to the webinar this morning, Falls Prevention Deserves Your Attention. This webinar is brought to you in partnership by Vintage Fitness and Stay Active Rehabilitation.
Oops.
I'd like to take just a few moments this morning and introduce the team that's bringing you the webinar. Aaron Bilowitz is owner and founder of Vintage Fitness, and Aaron is also a personal trainer at Vintage. Aaron's looking after our tech issues this morning. She's providing support. She'll also be offering some support via chat as well too. So if you have any issues with the webinar, if you have any questions as we proceed, feel free to pop Aaron a question in chat and she'll let us know. Myself, I am Corey Hanna. I am a personal trainer at Vintage Fitness as well. And Vintage Fitness offers personal training services to the older adult demographic. So we typically look after the 50+ crowd. I'd like to hand it over to Alejandra Rodriguez, the owner and physiotherapist at Stay Active Rehabilitation.
Good morning, everyone. Happy to be here again with all of you guys. So we are in week 2, and I wanted to just take a moment to inquire if you guys had a chance to do those balance assessments that we discussed in last week. Yes? Okay, and can you type in the chat box how did it go? If you have any, do you have any questions about them? Did you find, how was the balance? Was it fair, poor, was it good? Some of you are planning to do it this week. Good. Erin, is there any comments coming up in the chat?
So the can we know again? So one person was asking about access to it because they had to miss it. So we will send an email with a link to the recording from today and to the recording from last week for all the people that attended. So you'll be able to access it then. And someone else said there was no problem with the test. She did them, and she found it easy to do them.
Good, good. So yeah, for those of you that might be new this week, I would encourage you to have a look at, to go and listen to week 1 webinar. In it, we did a balance assessment. So there were, I believe, 4 exercises in there that give you a really good, accurate snapshot of how you're doing based on your balance. You can do those exercises at home safely, but and then you can record yourself. If there's one of those exercises that you find difficult or that you're not able to do, then that might be a signal that that is an exercise that you might want to incorporate in your daily routine for the next few weeks until you find that it becomes easier, because then it's going to enhance your balance abilities as well.
So Alejandra, the one test that a few people have found difficult is the close eyes balance test. That was challenging.
Yeah, and it's, remember also when you're doing that test, you are putting more pressure on your vestibular system, and then also the proprioception or the sensory information from your feet, from your ankles, your legs. So it's tough for a lot of people because many people, either their vestibular the vestibular system might not be as strong, or they might have an issue with the strength, balance, sensory information from the foot and ankle. So but the good news is that, again, if you practice that, and if you do practice it regularly for the next 3 to 4 weeks, it most is going to start to improve. It's going to start to get better. Okay.
And I think Alejandra mentioned last week as well too that if you are able to do all of those assessments successfully, that's a great job. That's a really good starting point. But you can actually consider it a starting point. So there are things that you
Yeah.
can do to make those activities harder, such as closing your eyes, starting to add in different movements, starting to add in different surfaces. So various ways that you can challenge your balance, the same way that you challenge your strength and do strength training. You can challenge your the systems that support balance as well too. So
Yeah, definitely. And you want to be able to like maintain what you already have, and then right continue to, like Corey says, to challenge yourself so that you can continue to improve. So today we are in week 2, and we're going to be talking about chronic conditions. So of course, because of time, we don't have a lot of times to go over all chronic conditions. We just narrow it down to 3 of the of some main ones that we see affect people when it comes to balance, coordination, and risk of fall. So the first one I'm going to touch based on, is Parkinsonism. We're also going to talk about lower back pain, which is so common. We know that about 80% of Americans at some point of their life, or North Americans at some point of their life, are going to experience an episode of lower back pain. And we're also going to talk about high blood pressure. Okay, so with Parkinson is a condition of the central nervous system. In which the region of the brain that is responsible for the dopamine production starts to deteriorate. And that is the part of the brain that is responsible for movement, coordination, balance. Parkinsonism, it's actually a group of symptoms. It refers to a group of symptoms that affect balance, affect coordination, and it presents with the same symptoms as Parkinson's disease, but it doesn't mean that person has Parkinson's disease. So somebody with Parkinsonism, they could have developed the condition due to, it could have been sometimes repetitive head trauma, certain medications, metabolic changes. So if somebody has kidney or liver failure or challenges, it could affect the brain's ability to coordinate itself and to release dopamine. And even there are studies that show that even continuous intake of pesticide in our food can contribute to Parkinsonism on some people. So some of the common symptoms of Parkinsonism that we see around movement is people tend to have continuous tremors. Their movement becomes slower. They're not able to, they lose their ability to move quickly. Their muscles also become tighter. Their posture changes. So as you can see here, there is this stoop forward posture. As a result, as a result at the hip, the muscles tend to contract and the stride becomes smaller. People tend to have what we call shuffling gait, where they're taking a lot of smaller steps to get somewhere because the stride length is significantly decreased. Sometimes often there's some speech changes, the slurred speech. Yeah. But however, what we know, and there is an overwhelming amount of scientific evidence that states that exercise is great in decreasing the symptoms, improving function, and slowing down the progression of this disease. At the same time, it also helps to enhance mood, memory, and of course, social engagement. So there is a lot of hope when it comes to Parkinsonism or Parkinson disease. Exercise really can help to significantly improve the quality of life, decrease fall risk, and help people live more active and fulfilling lives. So, and is there any question so far, Erin? Is there any comment, anything coming up in the chat?
Not specifically about Parkinson's. I know there's one attendee, Fiona, that teaches some clients with Parkinson's. So at some point we can get some information from her. But we do have a great comment from Nancy, who is a virtual training client of Corey, saying that she really notices an improvement in her balance. And when she did the tests, she said, well, Corey works on a lot of these things. So I did better on the test. So I guess it's a good testimonial to say the impact of balance exercises on these sort of fall prevention tests.
Yeah, absolutely. And Corey is great. He knows what he's doing. So.
And the clients deserve a pat on the back as well too, because they're putting in all the hard work. So pat on the back for yourself, Nancy. Thank you for the comments.
Yeah, that's what we want to see. It's all teamwork, right?
And that client that teaches Parkinson's, boxing to Parkinson's, said that if people have any other questions, then she'd be happy to chat more about what she sees with Parkinson's as well.
Excellent. So we do have Q&A as well at the end of the presentation. So that's also going to be another, we're going to be touching base again if you guys have any questions, comments, concerns. So I'm going to move forward. The next piece, of course, is lower back pain. So lots of people experience lower back pain at different points of their life. Like I said before, about at least 80% of Americans will experience lower back pain at some point. And there's so many misconceptions that I see when it comes to back pain, because it's one of the conditions that I specialize on, one of the conditions that I treat the most. And I've been doing that for about 15 years now. So when there is, as we grow older, of course, there's going to be the disc on our lower back are going to become more and more narrow, because there is gravity. Gravity is always pulling us down. So when it comes to lower back pain, a lot of people get focused on here, on the spine, where we see the red mark. They want to have x-rays, MRI, CT scan to, see what is going on in the spine. But what we know is that if you are as early as past the age of 30 years old, there's already going to be degenerative changes in your lower back. Again, because of gravity always pulling us down. But most people, for example, they did a study years ago where they took 100 people that did not have lower back pain. They were not experiencing back pain of any kind, and they did MRIs on them. And from those MRIs, they concluded that about at least 30% of them had mild findings. Another 30% had mild to severe findings, but yet they were all pain-free. So there is very little correlation between MRIs and the amount of pain that you might be experiencing. And the reason for that is that when it comes to lower back pain, a lot of people focus on what is going on in the joints, but they forget about the soft tissue. They forget to inquire what is the state of those muscles. How is the flexibility? How is the strength of those muscles? How are the joints moving and gliding in relationship to another? And that is what makes the biggest difference in helping somebody heal from lower back pain, because the better, the stronger, the fitter, the more lubricated the tissues are around here, that is going to help to support the inner structures, these bony structures inside your back. So whenever there's an issue with lower back pain, what we can also see is that is a complex. So your lower back, of course, interacts with your hips. Everything works together in unison. So if there is any inflammation going on, any tension, it's going to start to throw off the way how you're walking, how you're sitting, how you're standing, and it's going to restrict movement or walking patterns, like we were seeing, for example, in Parkinson before, right? That posture of stooping forward, which we often also see in people that have back pain or they've had chronic back pain. They tend to be stooping forward. They have little mobility, or they show little mobility in their hips and lower back when they walk. And that is going to affect, of course, your balance and your ability to react quickly.
So Alejandra, I'll just mention I'm looking at the results of the poll about medical conditions. Joint pain, 64% of respondents have some sort of joint pain, and then 55% are overweight. So it's interesting to look at the link between low back pain and having extra weight as well.
Yeah, yeah, and it's important, right, to consider that the spine is like the column, you know, like of the house. Is like the central pillar that supports everything else. So if these muscles are for example, let's say somebody who's more sedentary, who doesn't get enough exercise, and these muscles are weaker, and then there's more weight added in this area, right? We can imagine what that can do to that central pillar. It can start to develop cracks and weaknesses there, and that can become is something that is important to look into, and it's important to understand. Okay, these are the issues, but this is something that is most likely 100% workable, treatable, and things can get better.
And last week as well too, we talked about the fall cycle. And for those of you that maybe weren't able to join us for last week, when we looked at something called the fall cycle, if you have a fall, if you're unfortunate enough to have a fall, it can have a vast impact on your negative impact on your emotional state and physical state, mental state. So you may actually end up having fear of doing things, doing activities, etc., which puts you at more risk for having a fall. So when we look at chronic conditions such as lower back pain, for instance, if you have lower back pain, it can trap you in that fall cycle. So you may have a painful lower back. You don't want to go out and do things just because there's so much pain there, but it actually ends up contributing to an increase in muscle loss, an increase in muscle loss, a decrease in strength, decreases in agility, coordination, etc. So that if you have to go out at some point and do something, you're at a greater risk for fall. So these chronic conditions contribute to that fall cycle and sort of trap you in there if they're not looked after. And Alejandra's mentioned that. So you have to try to kind of break that cycle and manage the chronic conditions as best we can to help us going forward. So.
Yeah, and that also brings it back as well to what we were saying also last time, that fear, it's a strong emotion, but we can either choose to use, the fear can either limit us and keep us in a state of limitation where we don't want to move, we don't want to do things because we're so scared of what could happen, or we can take the fear and we can use it as a catalyst for change, to get information, to get help, to get support, to learn, so that we can start to make those positive changes that are going to help us build more confidence, decrease the fear, and make improve the quality of their lives.
So Alejandro, just one question that's come up about the relation to falls and osteoporosis. So that might be something that we can just tuck in our back pockets to answer in the question and answer section, maybe.
Yeah, and that's a really good question. Who asked that question?
It was anonymous, I'm not sure.
Okay, yeah. So, okay, so what we normally see, of course, when somebody is in this scenario, so we talked about somebody having lower back pain, maybe they're afraid of that, of what this could mean. Maybe they've gotten an MRI and the MRI show they have all of this, you know, results of degenerative disc disease, herniated disc, arthritis in their back. And now that person might be in a state of fear and concerned, and they don't want to move because they don't know if that's going to make them worse. And they're still afraid of falling and so forth. So we often see people gravitating towards things like crutches and assistive devices. And even though these things do have a place, sometimes they do help to provide safety and support. The issue with it is that if people tend to rely on them so much that they stop, they limit their ability to move. They stop challenging themselves. Because they look at the crutches or the rollator as a device that's gonna help them do all of the things that they want to do. And the issue with that is that, again, it leads to, there's no solution. So it's not addressing the root cause of the problem, it's not making their physical situation, it's not improving their physical situation. It is actually creating more compensations along the way. So if somebody has lower back pain and they're using a crutch or their mobility is really restricted, then after, you know, a few weeks, a few months, what we're going to see is that there's going to be more compensations. Other muscle groups, other structures are going to change to, in a way, support that limitation. Muscles are going to get, on other joints are going to get tighter, they're going to get weaker, and then mobility, right, becomes more and more of an issue with time. So what I always tell people is, there are a lot of cases of lower back pain when somebody lifts something or move in a certain way and they hurt their back, but then their back starts to feel better in a few days, and then that person starts to move with more ease, and then eventually the pain goes away. However, if that is not the case, if it's been a couple weeks and you're not seeing any improvements, you're not seeing any positive changes, then that's when we recommend, you know, get help. You know, see a physiotherapist, get an orthopedic physical assessment. So have somebody examining your back, not just getting an MRI or an ultrasound or an X-ray and thinking that that is going to show you the root cause of the problem. There's a lot of people that have really terrible looking MRIs and yet they have no pain and they're mobile. So MRI, CT scan, it can take a long time to get them, but they are misleading because it doesn't tell you how your muscles are firing, how your muscles are activating, what's your flexibility, how your joints are gliding in relation to another. It doesn't assess your function. So it's really whether an orthopedic examination does target all of those important parameters. And then once those issues are identified, whether the muscles, you know, or the structures are at fault, then you can start the right treatment and start to see results in a short amount of time. Most cases of lower back pain, and I've been treating lower back pain for about 15 years now, is that most cases of lower back pain are successfully treated without the use of medications, injections, or surgeries. There's very few cases when somebody needs, really requires surgery to improve their back issues. It's mostly in the cases of, for example, a severe fracture, tumors, and things like that. But the vast majority of cases, I would say at least 90% of cases, of lower back pain, they can be fixed without injections, medications, or surgeries. But the sooner you take care of it and address it, the faster you're going to be able to see results and start to get better.
Alejandra, just a question that's come up about lumbar support bands. Are those helpful with low back pain?
Yeah, it's the same. It's the same concept as in crutches, walkers, and things like that. It depends on how that person is using it. So, for example, if somebody has an acute episode of lower back pain, right, they might be able to use it so that they can start to move again, right? So that person might be in pain, but they're using the support so that they can do physical activities, the things that they want to do, so that their body can start to respond and they start to engage more musculature. They can start to work on their flexibility to become more functional, so that then they can start to win away from the brace. So that is a good use of the brace. When somebody's using it, but yet they're not continuously working on that body part, they're not fixing the root cause of the problem, and they're becoming dependent on it to do all of the things that their bodies should be trained to redo again. That's when it becomes more of an issue, because then it builds dependency, and it starts to the limitation is not being addressed. Yeah. So we're going to move a little bit, and Corey is going to demonstrate some exercises that are useful for somebody that has lower back pain. So these are exercises that are safe, that are easy to do. They shouldn't aggravate your pain, or they shouldn't cause further pain. You should be able to do them with ease. Breathing is really important. Do not hold your breath when you feel pain. Just keep reminding yourself to breathe. It's better if you move when you exhale, if you move through a whole exhalation. That's going to relax your body. It's going to help to engage more of your muscles, and it's going to make mobility much easier. And we're also going to demonstrate some modifications for most of these exercises. So Corey, are you ready?
I am, yes. Yeah.
So the first one I'm going to get you guys to do is called the Taller Rock Test, or the Rock Taller Test. This is a really good one to do, for example, early in the morning, if you wake up and you're feeling really stiff in your lower back, or if you, for example, were sitting in a couch for long periods of time, and then when you get up, you feel that your back is sore, you could do this exercise. So Corey is going to come into the mat, and he's going to come into a child pose.
So Alejandra, I'm just going to have you stop sharing your screen for a moment so they can see.
Oh, sure. Thanks for reminding me.
Yep.
Okay.
So everybody should be able to see me on my mat. And you talked about going into a child's pose. So I'm just on my knees on a mat. You could do this in your bed as well too, or on the soft surface. So I'm just, child's pose is bringing my bottom back. I'm just sitting on my heels and bringing my arms down the front.
Good. And from here, Corey is going to take a deep inhale. And on the exhale, he's going to glide his body forward until his back is in a full flexion. So if you see, he's going from a full flexion, and now he's going to go back to a full flexion of his spine. Okay. And this movement is something that you might want to do about 10 times if possible. Again, it's not meant to aggravate anything. It might feel, if you feel some discomfort is okay, but on a scale of 0 to 10, you don't want your pain to go higher than a 4.
And
Also,
Alejandro, we have quite a few clients that aren't able to go down to the floor. Is there a modified standing version that you can go through?
yes, we do. So Corey is going to demonstrate that right now as well. If it's hard to get on the mat, then you can just do this in standing. So you can place your hands on your back for support, and then Corey is gonna go back. Good, and now you can go forward. And again, you take your time with this. If you notice that you also have dizziness, blood pressure changes, then just take your time with this one. And a good recommendation also is to do it in the corner of a room where the walls meet, so that if you feel that you need support, you can hang on to the wall. Okay. And the next one we're going to do is, this is to help the joints in your lower back and your hip to glide together with more ease. So with this one, you can do it, let's do it in sitting first, Corey. Okay, so if you want to do it in sitting, if your back feels really, really sore, then bring your elbow, bend one elbow, and bend the opposite knee, and bring those two together. Good, and now bring them down away from each other and switch sides. Good, and come back. And again, repeat on the right and opposite side. If this feels easy and there's little to no issues, then just try it on standing. And again, you might want to do it on that corner of the room to help with the balance, to help to decrease risk of fall or losing your balance. Good. All right. And the last one is, this one is with the help of a belt or a strap. So when someone has lower back pain, usually they tend to have, there tends to be a specific movements that aggravate that pain. And then there are other movements in the lower back that tends to decrease the pain or that are non-painful. So for example, if you have pain when you do an extension or a back bend, when you bring your back down, but when you go into flexion, that helps to relieve pain, then you want to do maybe 10 to 15 forward flexion motions, and then to try to do an extension and see if that pain gets better in extension. So usually once you move in the non-pain ranges of motions initially, and then you attempt to move into the pain ranges of motions, by then the pain usually has subsided because you have glided your joints, engage your musculature, gotten the circulation in a gentle way, that when you move into your painful range, it tends to feel easier. So Corey is going to demonstrate an exercise as well that you can do if you want to practice your extension. So he has a belt in the lower back, and he is pulling the edges forward and up, so in a diagonal position. And from here, he's going to do a back bend. So back bend is when you're extending your lower back. And now from here, he's going to go all the way down into a flexion. And repeat back.
Alejandra, is this safe for people that have degeneration in the discs of their spine?
Mm-hmm. Yeah, so again, it depends. If you have degeneration of your spine, movement is really important. You need to get that movement in, because think of degeneration or inflammation as though the rust in a car, right? When there's rust in a car, it's going to affect the way how those, how those pieces are moving. It's going to affect the function of those pieces. So once we decrease some of the rust that's there, maybe put some oil, lubricate the area, then the movement starts to improve. And it's very much the same concept with the human body. When we start to incorporate exercises in a gentle way, right? It's not about this exercise, if they're increasing your pain level to, a 5, a 6 or beyond, you need to take it down a bit. You need to take it down, tune more into the breathing, and just start to move, but in a way that's gentle. Whatever you can do to move, that's where you want to start. And you just continue moving in that gentle manner until your body starts to respond. And then you'll notice that, you can start to do certain movements, certain activities with more ease. Okay, so I'm going to go back to sharing my screen. Thank you, Corey.
You're welcome.
And so we did those 3 exercises, and now we're going to talk a bit about high blood pressure, which of course is another big cause for concerns among a lot of people that are 50 plus, and as well, a cause for falls and people being at risk of falls. So we know when your systolic pressure is higher than 140 and the diastolic pressure is higher than 90, that's what we categorize as somebody having high blood pressure. And there's a lot of people that can have high blood pressure, but they might have no symptoms. Okay, that's something that is very common that we see. So it is important as well, of course, to get those checkups to check how is your blood pressure doing, to look at what you can do to decrease that blood pressure, such as decreasing your salt intake, sometimes getting medications from your doctor, and then of course exercise. So exercise is going to help your body balance and correct the blood pressure issue. If your blood pressure is higher than 180 and 100 of diastolic, then you would probably want to consult with your doctor and get medications from them prior to engaging into a physical exercise. The exercises are naturally going to increase your blood pressure while you're doing the exercise, but then it's going to decrease. And the better the body is able to bring down your blood pressure after exercise, then the fitter you essentially are. And some of the symptoms of blood pressure is headaches, nosebleed, confusion, vision problems, chest pain, among others. And of course, one of the main concerns with high blood pressure is the risk for stroke. So yeah, very important to monitor your blood pressure, and very important to take actions, precautions, looking at changes in lifestyle, decreasing salt intake, decreasing processed food, eating more produce, vegetables, and getting your daily regular exercise.
And high blood pressure can be caused by a number of different things as well too. We have clients that have congestive heart failure, for instance, and high blood pressure is a byproduct of that. So it's learning again to try to break that fall cycle where if you have congestive heart failure or a chronic condition, and you're worried about falling and you stop doing all activity, that's not necessarily a good thing. So you may decide that with congestive heart failure, for instance, you start pacing activities.
Mm-hmm.
So you start out slowly, do small things, small baby steps. Maybe you choose a time of the day that works better for you, where you're feeling better, but you're doing something at least to contribute to ongoing health and fitness. You're not just staying sedentary and contributing to that fall cycle. So
exactly, we want you guys to be able to break that cycle, to start to make those changes. Don't let the fear consume you or make you believe that this is permanent, that movement is bad, that it's going to be like this forever. That is really not the case, and that's where a lot of people get caught, unfortunately. Me and Corey, we've been doing this for a long time, and we can both tell you that when it comes to lifestyle changes, when it comes to exercise, it's when you start to implement those things in your life, you are going to start to see yourself in that positive, in a positive cycle. You're going to feel better. You're going to be able to move more. You're going to be able to go see your friends, do things that you enjoy. You're going to start enjoying your life more, and that's what it's all about. So to tie it all up, based on what we discussed today and what we saw today, yes, there are things that can happen to our bodies, but for the most part, what we do, the things that we're doing, our daily habits, our lifestyle, is what's going to have the biggest impacts on how we're aging, our quality of life, how much function and mobility we are getting. And this is what we call the pillars of good health. So your exercise amount, and I fully understand that when it comes to exercise, it can feel overwhelming for a lot of people. If you do something, if you do a specific movement and that causes pain, doesn't mean that you shouldn't do it, or should you modify what is the right intensity, what's appropriate, what's not appropriate. There's a lot of legitimate questions and concerns that people have. And someone like me and Corey, we spend years of our life just studying about exercise and exercise therapy so that we can provide to people the right type of exercise for what they're going through, for their condition, and based on what their goals and their needs are. It's important to have that knowledge, to have that support. Medical doctors, general practitioners, even though they're essential to our healthcare system, they are not exercise therapists. So they can tell you, Miss Smith or Miss Jones, you have to go and you have to be more active and exercise, but they're not going to, they might in most cases not be able to tell you exactly what are the small steps that you need to do in order to get there. People generally get the most gains, they see the best results when they have that guidance, when they have that support, where they have that coaching in every step of the way, because things are going to change. When you start exercising initially, there's certain things that you're going to bump against. There's going to be certain challenges. And then we need to be able to modify things and change things so that you can overcome those challenges. Sometimes it's more about consistency. You know, even though it feels difficult, you need to continue to do it for a few times, and then you start to see it becoming easier. Nutrition is very similar. Nutrition is such a broad field, and there's all kinds of different diets out there that people inquire. Should I follow the paleo diet? Should I, follow a vegan diet, Mediterranean diet? Like, what is the right type of diet for me? And that's why I included here a link to this website. It's called nutritionfacts.org, and is run by a medical doctor that he studies all of the latest research on nutrition. And remember, it's always changing. We're always discovering new things. So same as in exercise, we're always getting better at finding better ways of doing what we're already doing. So in this website, he takes the research, and he has a team of people as well that compile the latest research for him, and then he summarized it in a way that's easy to digest and to understand. Same thing as relaxation. Relaxation is so important for our bodies and also for our minds, because we want to ideally be making solutions from a good place, feeling good feeling positive mostly on our day-to-day, enjoying our lives, feeling hopeful, experiencing joy on a day-to-day basis, being able to feel relaxed and calm and grounded. That's important, that we feel that day, that we experience some of those emotions on a daily basis. And TV watching is not relaxation. By relaxation, I truly mean something like meditation, deep breathing, prayer, yoga therapy. These are things that just make people feel at ease. It's what allows people to release some of their daily stressors, to stop thinking about their worries, the problems, all of the negative things in life, and to, just reconnect, so that when you are making decisions, when you are faced with a challenge, you can make a decision from a more hopeful place. Sleep as well. Sleep is so important, because that's when our bodies restore and regenerate. If you're getting interrupted sleep, if you're waking up 2 or 3 times at night, and then when you wake up, you go and you turn on the TV, and you're getting the screen glare on you, that's something that you might want to look into and change and consider, because is so important for all of us, that we're getting good restorative sleep, that we're waking up the next day feeling refreshed and ready to go. Is going to help to bring down the inflammation markers in the body. It helps to decrease down pain levels, and probably also blood pressure, to normalize those hormones, to for our brains to be able to have that rest and relaxation from overdoing or overthinking. So again, those are things that you have 100% full control over.
Alejandra, I just wanted to touch on exercise therapy as well too. Sometimes people will get scared of the word exercise,
Mm-hmm.
or it's really a barrier to them if they've never exercised in their lives. And for some of our demographic, they've never exercised.
Yeah.
Or at least they've never exercised to what they believe exercise is. And they picture big hulking men or women in the gym and lifting heavy weights and training for Olympics and those types of things. That's not necessarily what your exercise program is going to look like for you. You can start out with a gentle exercise program that gets you up and moving, and is you're very capable of doing, and you'll be surprised at just how much better you feel just by moving even just that little bit. So don't let your fear of exercise stop you from becoming more active. If you have a good trainer or a good support system, they'll give you the exercise that will get you up and moving appropriately. So
Yeah, it has to be right for you. It has to be customized to you and where you are right now. Okay, and here is a video that I really wanted to show you guys. I'm gonna go ahead and play it. And this is, so this lady, she just passed away a few months ago. She was 102 years old. I'm going to repeat, she was 102 years old, and she was teaching yoga weekly in New York. She is she was the world's oldest yoga teacher. She was also a ballroom dancer as well. And yeah, let's hear what she had to say. Oops.
Being on this earth is very precious, but if you don't do anything with it, then you might as well be dead. Tao, T-A-O, Poshandish. I marched with Mahatma Gandhi when I was 12 years old. And he was, in spite of all that he was up against, still managed to smile at the whole world and make you feel that nothing was impossible. If I can turn on that wonderful essence that's within the body and make them people feel that nothing's impossible for you, then I feel that life has been worth living. Don't waste your time sitting there thinking of all the negative things. Just turn and say, going to be the best day, and it will be. I face the day with that in mind, not trying to think how it's going to happen, but it will. Nothing stops in life. You don't just spend your time thinking, go and do. All paths lead you to the top of the mountain. It doesn't matter which one you take. Get away from all of these things like this. Little boy asked, little boy question. Good. 5 minutes later, asked the same question. I start. I said, what are you doing there? He said, well, I gave the answer. I said, you mean to say that that instrument knows more than you? And he looked at me, he looked down, and he walked away, standing straight. But before that, he was all hunched over. I don't want to raise them all like this. I want to raise them to open up their hearts, the door, their heart. And if you don't do it with children, they're not going to get very far. Even some of my friends who drive a car, talking to them, you don't have to do that in life. Let's talk to each other. Don't waste your time on what you can't do. Don't even think about the verb. So you want to say nothing's impossible.
Yeah, it's a very, very inspiring lady. And I also have as well another a testimonial from an Erin. I believe she's one of your patients, Pat.
Yeah, so the reason I bring Pat up is the results that she's achieved through both in-person personal training with Vintage as well as virtual training. So she's lost 30 pounds, she's lowered her blood pressure, and she's now able to get up out of a deep couch without even thinking about it. Those are the highlights of what she's achieved. I think it's also worth considering what she overcame to be able to continue. One is she had a life where her whole life was about other people's health and taking care of everybody else for years and years. And she was able to prioritize her own health. And I think that was a pivotal change in mindset for her to be able to achieve the results that she has. And just feeling a lack of confidence. She spent a life dieting on a yo-yo diet. She tried every different type of diet. Her weight was up, her weight was down. It was dramatic shifts, which is hard on the body and hard on the mind. So just getting the confidence that if I do slow and steady steps, do the right thing from one day to the next, I will make long-term progress, as opposed to being on what felt like a real roller coaster for her. So she achieved tons of body benefits, but she also changed her mindset a lot.
Yeah, and I really love it how you say, like she tried, you know, the kind of the extremes and then didn't work for her. And then she realized, you know, the slow and steady, it's what brought her results. And that's also what I see constantly with people is sometimes people get really pumped up, like, oh, I'm going to do this, I'm going to go to the gym and I'm going to do this training. And then when they encounter that first challenge or roadblock, they give up. But when you understand, like, this is very much a journey, and it's going to be just you know, a small change every day, that is doable for you, that's not going to take a long time, that's not going to feel so arduous to do, you know, you are going to start to see results, because then it becomes a habit, it becomes automatic, it's something that you just do. And that's when people start to notice the changes. I also I have a patient currently who I've been training for about a year now. I think he's in his 50s, but he had a stroke about 20 years ago, and that left him from the hip down on the right side. He has a lack of mobility there. When he first came, there was a lot of tension. There was a lot of tightness. He wasn't able to coordinate himself very well when he was walking. He had a drop foot, and he was wearing a device for that. And so we started working. He was coming regularly. During COVID, we did everything online. We did all of his exercises online. And yesterday I just saw him, and we were talking how like amazing it is of all of the changes that he's doing. He was like, I'm doing things right now with you on our daily exercise that I would have never thought I was going to be able to do about a year ago. And now he's going for long hikes. He wasn't able to do that before. And I think a couple of weeks ago, he went somewhere for like a 4-hour hike in a terrain that was like up and down. And he's done those a few times already, but that was the longest hike that he's done so far. And he was like, I came back and I had very little pain or discomfort. Yeah, so it's really important to, you know, understand when you do hit a roadblock or a bump, it doesn't mean that it's not working for you, or it doesn't mean that, you know, that it's not possible for you to have this kind of result. Of course you can, everybody can. But what it is that sometimes it just, things need to be tweaked or modified, or there might be a piece that you're missing, or there's a piece of information that's going to make a difference for you. So that's where the expert advice and the guidance, it's so important.
So Alejandra, I'll just give you, it's about 1 minute to 11 now in terms of timing.
Yeah. Do we have, should we go over some comments or questions, or do you want to take over and talk about the
program? Yeah, so if you do have any questions, we can cover them on Q&A on the on Zoom Q&A, which a lot of you have been sending me questions, which is great. You can ask them on chat. You can also stay for a few minutes later. We do have a 6-week fall prevention program to offer. And if you're interested in learning more about it, we're quite excited about it. There's a couple of different options. One is a 6-week program that starts with a fall risk analysis with Alejandro, then with for 45-minute virtual personal training sessions with Corey that are specialized to help you, your specific situation, prevent falls. And then you follow up with the 6th session, which is another risk assessment, and we should see that risk assessment profile change. We can also develop some customized programs just for you. So I'm gonna, if there's any questions, let us know. And I'm gonna end the webinar officially, but if you wanted to stay on and find out a bit more about our fall prevention program that we have for this group, please do stay on. I'll unmute you and we can tell you a little bit more about it. So there is, sorry, go ahead, Corey.
And just before we end, we did have that one question about osteoporosis and falls. We'll try to answer that in weeks 3 and 4 if we can, or get it to you individually to talk to you about that as well. So.
Mm-hmm.
So again, thank you very much for taking the time. We have our last fall prevention webinar next, is it our last one? No, our 3rd one. It's a 4-week program. Next Wednesday, same time at 10 o'clock. And Corey, do you want to just go through what we're going to be covering in that webinar?
Yeah, we're going to be taking a look at impairments and behaviors. So impairments, examples of impairments may be muscle loss, vision loss, hearing loss, going over those things, and behavior as well too. So there may be particular behaviors that we have as individuals that are putting us at higher risk for falls. So we'll just be reviewing some of those and doing activities as well too.
Great. So have a lovely day. Again, if you want to find out more about our fall prevention program, please do stay on the webinar and we'll have a chat about it.
And I'll see you next week. Thank you, guys.